Is stress a major risk factor for stroke? Stress is something most of us experience daily, but how much does it really affect our risk of having a stroke? While stress alone doesn't directly cause a stroke, it can play a significant role in increasing the chances of one happening. Chronic stress can lead to sustained high blood pressure, which is the leading modifiable risk factor for stroke worldwide. When stress persists over time, it keeps blood pressure elevated, putting extra strain on blood vessels and increasing the likelihood of blockages or bleeding in the brain. Stress also triggers inflammation in the body and can impair the lining of blood vessels, known as the endothelium. This damage promotes the development of atherosclerosis, which is the hardening and narrowing of arteries caused by plaque buildup. Narrowed arteries can restrict blood flow or even rupture, leading to ischemic or hemorrhagic strokes. In addition, stress often influences behaviors that raise stroke risk, such as poor sleep, unhealthy eating habits, physical inactivity, smoking, and excessive alcohol consumption. These lifestyle factors are well-known contributors to cardiovascular disease and stroke. For example, stress may lead someone to reach for comfort foods high in fat and sugar or to skip exercise, both of which increase risk. Research shows that people experiencing ongoing stress at home or work have higher chances of having a stroke. Some studies suggest that younger women under chronic stress might be especially vulnerable to certain types of stroke, even when no other risk factors are present. However, the relationship between stress and stroke is complex and influenced by individual factors like age, sex, and overall health. While it is difficult to measure stress precisely or prove a direct cause and effect link, large population studies consistently find that high levels of chronic stress are associated with increased stroke risk. Because of this, managing stress is considered an important part of stroke prevention. Practical steps include practicing relaxation techniques, seeking counseling if needed, and making lifestyle changes to reduce stress levels. Monitoring and controlling blood pressure, maintaining a healthy diet, exercising regularly, getting enough sleep, and avoiding tobacco and excessive alcohol are also crucial. In summary, stress acts as an indirect but significant risk factor for stroke by worsening other risk factors and promoting unhealthy behaviors. Addressing stress through lifestyle modifications and medical support can help lower overall stroke risk. If you experience persistent stress, it's important to consult healthcare professionals who can help develop a personalized plan to manage stress effectively and protect your brain health.